Good morning to all. Welcome everybody. And in this lecture, we are going to see the remaining points from pharmacodynamics. In the yesterday lecture, we have seen what are the different type of receptor and all that. Just remember the types of receptor. They are very important. Their synonyms and all that. Clinical trials are very important. So that important part we have finished. Now in this lecture we are going to start another part. Pharmacodynamics, their mechanism of action and what are the different types of adverse drug reactions. Because this part is important for your GPAT Niper also and other exams also. So they used to ask question on types of adverse drug reaction, dynamics parameters. We have seen the general introduction to pharmacology, few important definitions, route of administrations, the pharmacokinetic like absorption, distribution, metabolism, elimination in the detail. Each and everything we have covered in the detail. It's then again after that in the last lecture yesterday we have seen the different types of receptor and all that, their signaling mechanism and all that. Mechanism of drug action. How drug will act? A particular drug is producing a particular pharmacological actions. So how how it will act? So what are the different mechanism for drug action? So drug may either stimulate a particular system, or drug may depress a particular system, or drug may produce a irritant effect, or drug may be used as a replacement for endogenous substances. So these are the different mechanism of action of drug. First one is stimulation. So stimulation means increase in the activity of anything. So increasing the activity of your cell or increasing the activity of your tissue or particular system. So stimulant action means any increase in the functioning of cell or tissue or organ or system. So drug may act as a stimulant. So there are certain drugs they are exerting their stimulant action. For example, your adrenaline. Adrenaline will stimulate the heart in case of shocks. Adrenaline is a drug of choice in case of anaphylactic shock. So adrenaline stimulate the hearts, stimulate the heart. तो adrenaline stimulate करता है heart को and it is drug of choice in case of anaphylactic shock. So it exerts the action by stimulation. Next one is a depression. So anything that can anything that can decrease the functioning of particular cell or particular organ or tissue or system, you call it as a depression. Okay. So for example, quinidine depresses the heart, morphine depresses the CNS. Then all kind of sedative hypnotic drugs they used to depress the CNS. Okay, so they decreases the functioning of your central nervous system. So that's why they exert their action by depression. Okay, so stimulation is also one of the action for drug. Depression is also one of the action for drug. Then again, next one is a irritation. The system which will irritate the system and they will cause inflammation, corrosion or necrosis. For example, for example, counter irritant drugs. Counter irritant drugs. For example, your salicylic acid. It is used as a counter irritant externally. So that exert action by irritation. So irritation causing inflammation, corrosion or necrosis to the tissue. Then next one is a replacement. A drug will be act as a replacement therapy for deficiencies, for various deficiencies. For example, if you have vitamin deficiency, now you are giving external vitamins. So that external vitamin will act as a replacement therapy. For example, in case of hormones also, replacement of hormones, then replacement of metabolites, replacement of vitamin in case of deficiency. For example, if you are suffering from insulin deficiency, that means replacement of insulin is the replacement therapy. Okay, so drug may act by stimulation, depression, and replacement therapy. There are different action of drug. A drug may act by stimulation. Drug may act by depression. Drug may act by irritation. Drug may act by replacement therapy. Then drug will exert action on the cell. Drug will kill the cell. So cytotoxic action. Cytotoxic means those drugs which are used to kill the cell. Okay, that cell may be your cell or cancerous cell or antibacterial cell or foreign bacterial cell. Okay, so most of the antibacterial drug and anti-cancer drugs, okay, they exert their action by cytotoxic action. Cyto means cell, toxic means cidal or killing. Okay, so cytotoxic action means those drugs which will kill the cell of whom, cell of cancer cell or cell of your foreign microorganism, bacteria, virus or fungi. Drug may exert its pharmacological action by different mechanism. It may either stimulate a particular system, cell or tissue. It may replace the particular cell, tissue or system. It may cause irritation, inflammation, corrosion to or necrosis, particularly in case of that counter irritant drugs. Then drug may act as a replacement therapy. For example, if you are suffering from any deficiency of vitamin, deficiency of hormone, then replacement of that hormone or that vitamin will act as a replacement therapy. Then drug may be act as a cytotoxic, cidal to the cell or toxic to the cell. So particularly antibacterial drugs and anti-cancer drugs, they exert their action by this mechanism. So antibacterial cell, they will kill the microbial cell. Okay, so antiviral drug जो है वो वायरस को किल करेंगे, एंटीबायोटिक जो है वो बैक्टीरियल सेल को किल करेंगे, एंटी कैंसर ड्रग जो है वो कैंसरस सेल को किल करेंगे. So likewise that. Now drug may modify your immune system. So modification of immune system, drug may act by modification of your immune system. For example, glucocorticoids, immunosuppressants, okay, immunomodulators, there are a lot of examples. So how they will modify your immune system? For example, you are suffering from any kind of inflammation, then doctor or physician used to prescribe a steroidal drug, glucocorticoids, like dexamethasone, betamethasone, prednisolone, etc., etc., okay, triamcinolone, etc. So these drugs, they act on intracellular receptor. Yesterday we have seen that. So they will modify the expression, gene expression. So inflammation is nothing but there is a release of inflammatory chemicals like cytokinins, then your prostaglandins, okay, prostaglandins, cytokinins, leukotrienes, etc., etc. So if they are released means their production is there. So their production is increased in case of inflammation. Glucocorticoids will attach to intracellular receptor. They will bring a modification in the gene expression and they will decrease the synthesis of these inflammatory mediators. So glucocorticoid will act by modification of your immune system. They are basically, they are immunodepressant. They will depress your immunity. For example, most of the anti-cancer drugs also, they used to decrease the immunity. Then immunomodulator, what are the immunomodulator? Immunomodulator means those drugs which will increase your immunity. Okay, so drug may act by stimulation, depression, irritation, replacement therapy, or cytotoxic action, or by modification of immune system. So these are the just mechanism. Okay, now how this stimulation is done, how depression is done, how replacement or how cytotoxic action is done, or how modification of immune system. So drug can act stimulant, depressant, or this cytotoxic, but how? By acting by various kind of receptor, by acting on a various kind of enzyme, by acting on a various signaling mechanism. So what are those? So drug may act as a these stimulant, depressant, cytotoxic by immune through using the receptors. They act by through the receptors or enzymes or pumps or ion channels. Pumps means, for example, in case of receptor, you have alpha receptor, beta receptor. In case of adrenergic system, you have you have then you have muscarinic receptor, nicotinic receptor. In case of cholinergic system, so drugs will modify the action. They will either stimulate, they will either depress by interacting with the receptor. Again, drug can exert the action, that is stimulation, depression, or cytotoxic by interacting with the enzymes. For example, your if you take example of your acetazolamide is example which will inhibit the your enzyme carbonic anhydrase and act as a diuretic, interacting with the enzyme. Okay, again, if you take example of neostigmine, that is also inhibitor for reverse that is a cholinesterase inhibitor. Okay, so drug may act as a stimulant, depressant, or this cytotoxic action by interacting with the receptor by stimulation or stimulation or inhibition of enzyme, or by interacting with the various kind of pumps. Okay, for example, those drugs which are known as a anti-secretory agent or proton pump inhibitors. So proton pump, it is just exchange pump, ion exchange pump in the stomach, and that is responsible for the generation of acid in the stomach. Okay, now omeprazole, rabeprazole, dexamethasone. So these kind of drugs, they are known as a proton inhibitors. So they will interact with this pump and they will uh, they will exert their pharmacological actions. Okay, then again, drug may interact with various kind of ion channels. For example, if you take example of diazepam will act on a GABA gated chloride ion channel. Drug may interact with either receptors or enzymes or pumps or ion channels to exert their pharmacological actions. Okay, or drug may exert physical action directly or chemical action. For example, physical action means adsorption. For example, if you are consumed any toxins, or if you consume any poison, or suppose that you are accidentally consumed alkaloids, so you are suffering from alkaloidal poisoning. So in that case we are using activated charcoal. Okay, you are given activated charcoal. So activated charcoal will adsorb the unabsorbed toxin or alkaloids from the stomach. So thus its activated charcoal can be called as a drug, and it exerts its action by physical action, that is adsorption. So adsorption of unabsorbed toxin from your stomach, that will be adsorbed on the your charcoal. So that is a physical action. Chemical action, for example, if you are using any antidote in case of heavy metal poisoning, calcium EDTA. Calcium EDTA is nothing but the chemical antidote. So it will form a complex with the heavy metal by chemical interaction. So by chemical bonding. So that's why a drug may be either exert action by receptor enzymes, or interacting with the various kind of pumps, interacting with the various kind of ion channels, or drug may exert action, stimulation, depression, or whatever it may be, by their its physical action or by chemical action. That's how drug will act. Okay, or drug may alter your any metabolic process. Okay, drug may alter your any metabolic process. So these are the different action of drug, how drug can act on a body. Let's see the mechanism of drug action again. So I have summarized over here in the first column type of action, in the sub column subtype. Okay, now we are seeing the examples. So mechanism of drug action and examples. So type in the first column type, second column subtype, and third examples. So for example, drug may act by its physical action. So for example, in case of poisoning by various kind of alkaloids, or by poisoning with toxins, टॉक्सिन का poisoning हो गया या फिर अल्कोलाइड का poisoning होगा, in that case you are using activated charcoal to adsorb that poison from the stomach. Okay, so that is nothing but the physical action. Adsorption is a physical phenomenon. That's why the activated charcoal is exerting its pharmacological action by physical action, and that is the example of physical action. In the physical action itself, mass of drug, bulking agent. Okay, for example, isabgol husk you are using in case of constipation. Okay, isabgol husk आप constipation में use करते हो तो isabgol husk it will go in the stomach, it will absorb the water, and it will increase the bulk in your intestine. So अगर आपके intestine में bulk increase हो गया, so that increased bulk will stimulate your intestinal peristalsis. So constipation will be relieved by mass of drug. Example is isabgol husk. Again, by its osmotic property. For example, osmotic diuretic. So they will exert osmotic action over in the kidney. Because of their osmotic action, they are water loving. So whenever there is excretion of menthol, so along with menthol water will also go. So that is osmotic diuretic. Example is menthol. So osmotic purgative, magnesium sulfate. So they are exerting whatever the action is, either laxative or diuretic action, because of their osmotic property. Okay, so that is again a physical, that is again drug acting by physical action. Okay, again radioactivity of the radioactive activity of the compound. So most of the radioactive compound, they are used as a diagnostic agent. Okay, for example, iodine 131, barium sulfate, contrast media. So they are not drug, but they are a diagnostic agent. So they are also useful because of their radioactivity. So this is how physically drug may act. Drug may act by its absorption property, by increasing the mass, by osmotic property or radioactive property. Now chemical interaction. For example, take an example of antacid. Suppose that you are suffering from acidity and you are taking sodium bicarbonate, aluminum hydroxide gel, magnesium trisilicate. So whatever the drug, these are aluminum hydroxide gel, magnesium trisilicate, sodium carbonate. So these chemicals, they are chemically reacting with your acid in the stomach. They are neutralizing the acid. Okay, there is a chemical reaction, that's why. So antacids, they neutralize the acid in the stomach by chemical interaction. So drug may exert the action by physical action or by chemical action by, for example, another example, take an example of potassium permanganate. Potassium permanganate is germicidal or bactericidal. Okay, so it is a bactericidal by because of its oxidizing property. So it will oxidize the bacterial cell content. That's why bacteria will die. So chemical interaction. Again, drug may act by altering the metabolic process. For example, sulfonamides, then trimethoprim and all that. For example, methotrexate is also there. So all these drugs are they are inhibiting the bacterial folic acid synthesis. Okay, sulfonamides, then methotrexate, trimethoprim. So these are the folic acid antagonist. Okay, so they will inhibit the synthesis of folic acid in the bacteria. So they are altering the metabolic processes of the bacteria. So they are acting by altering the metabolic process of the cell. Okay, so these now drug may act via various kind of receptors and enzymes. Okay, so for example, drug will change the permeability of ions. For example, in case of drug may interact with the ion channels and they will change the permeability. I have told you example. Diazepam is nothing but the diazepam is a CNS depressant or sedative hypnotics. Okay, sedative hypnotic drug. It will bind to benzodiazepine receptor and it will increase the chloride ion permeability. It will increase the permeability for the chloride ion channels. Okay, so by changing the permeability for ion channels, drug may exert its action. जैसे होता है ना का normally what happens inside the cell, inside the neuronal cell there is electronegativity. Suppose that if sodium goes inside the cell, so there is a disturbance in the polarity of the inside the cell. So that is nothing but the depolarization, and once there is depolarization there will be generation of action potential or conduction of your nerve. Then if chloride ion goes inside the cell, and you know that already inside the cell there is electronegativity. Okay, already chloride is present in the cell. So suppose again chloride ions goes inside the cell, that means there is a hyperpolarization of the cell, and if there is a hyperpolarization, so cell will not generate action potential or cell will not conduct the action potential. So depolarization result in the stimulation action, and hyperpolarization result in the inhibition of or depression action. So that's why diazepam will depress the CNS by acting on ion channels. Then G protein coupled receptor drug may interact with the G protein coupled receptor. For example, propranolol, beta blockers. Beta blockers they will act on a beta receptor. Propranolol is also beta blocker. Kinase linked receptor, insulin and its receptor. We have seen the type of receptor in the yesterday lecture. Okay, what is meant by ion channel, inotropic, what is metabotropic, what is kinase linked, what is intracellular receptor. We have seen this. Intracellular receptor hormones will interact with the intracellular receptor. Now these are the mechanism of drug action. How drug can exert their pharmacological action. They may exert by physical action or chemical action or by alteration of material process or by interaction with the various kind of receptors. Now, what are the adverse drug reaction? So, adverse drug reaction: any noxious or undesired effect of drug used in the prophylaxis, diagnosis, or treatment. So, any abnormal or noxious or undesired. Now, what is desired and undesired? So, suppose that you are taking insulin for suppose that you are taking any drug insulin for to decrease the blood sugar level. So you are taking insulin to decrease the blood sugar level. Okay? And insulin will decrease it, no doubt. So that is a desired action. ठीक है, आपको इंसुलिन क्यों लेना है कि ब्लड शुगर लेवल कम करना है, दैट इज अ डिजायर्ड. वो क्या एक्सपेक्टेड है आपका डिजायर्ड एक्शन. ओके, बट इफ इंसुलिन इज प्रोड्यूसिंग एनी अदर एक्शन, सपोज दैट इफ इंसुलिन इज प्रोड्यूसिंग एनी इरिटेशन, insulin is producing any convulsions, so that is a noxious, that is a abnormal. Okay, so any noxious or undesired effect of drug other than pharmacological action, so that is nothing but the adverse drug reaction. And pharmacovigilance deal with the epidemiological study of adverse drug reaction. So pharmacovigilance, what is the role of pharmacovigilance? So to monitor the adverse drug reactions. Okay, so that is nothing but the adverse drug reaction. Suppose that you have taken any CNS depressant drug. For example, take an example of diazepam. So diazepam अगर आपने लिया CNS depressant, so you are taking it as a hypnotic drug. Ideally, what is a desired pharmacological action of hypnotic? So it will induce a sleep. It will induce a sleep, and that is a desired pharmacological effect. But if the diazepam is causing anterograde amnesia to you, that is an undesired effect. That is an adverse effect. Okay, anterograde amnesia is the adverse effect of your diazepam. Okay, but what is a desired effect? Hypnosis. But along with the desired effect, you are getting the another effect, that is amnesia. Okay, and that is known as a adverse drug reaction. Okay, so any noxious undesired effect of drug used in the treatment, mitigation, or prophylaxis. That is known as a adverse drug reaction. Okay. Now there are certain terms like side effect, untoward effect. Okay. So we'll see it. Now what do you mean by side effect? So it is a predictable and may or may not be extension of pharmacological effect. Dryness of mouth, for example, dryness of mouth caused by atropine. So most of the time you get confused with what is meant by side effect, what is meant by adverse effect, what is meant by untoward effect, what is meant by side effect and adverse drug reaction. It is a type of adverse drug reaction. Side effect is nothing but a type of adverse drug reaction. So side effect is a predictable. You can predict what kind of side effect will be there. For example, so suppose that you are taking antacid for long period. So if anybody is on antacid therapy for a long period, obviously he is going to suffer from a chlorohydrate. Okay, so that may be a side effect which is predictable. We can predict. Okay, so for example, dryness of mouth caused by atropine. कि atropine का therapy, atropine का treatment अगर किसको चल रहा है तो obviously dryness of mouth will be there. So that is a predictable adverse effect and that is known as a side effect. Okay, so whatever predictable adverse effect or which may be extension of pharmacological activity or may not be extension of pharmacological activity, that is known as a side effect. Okay, so example is dryness of mouth caused by atropine. So atropine is an anti-muscarinic and that's why it will cause dryness of mouth. Okay. Now next is untoward effect. What do you mean by untoward effect? So again, undesired effect produced by therapeutic dose of drug. For example, potassium loss during the diuretic therapy. Okay. So what is the difference between side effect and adverse drug effect or untoward effect? Sorry. So basically, the difference is nothing but the side effect. You can predict it. You can predict it, and it is a tolerable. Okay. Side effect is a tolerable. You can tolerate it. Okay. For example, I have told you the example at dryness of mouth by atropine. So if you are suffering from any disease and atropine is the drug, okay, so you may develop a dryness of mouth. That is side effect. But dryness of mouth is not much giving much trouble to you. Okay, so you can tolerate little bit dryness of mouth. Okay, but you cannot tolerate huge potassium loss during diuretic therapy. So it may alter your hemostasis. It may alter your okay, so it may alter your the composition of salts in the blood. Okay, so that is the untoward effect means undesired effect produced by therapeutic dose of potassium, therapeutic dose of drug. For example, potassium loss during diuretic therapy. कि डायोरेटिक्स मतलब जो डायोरेटिक ड्रग्स है वो मोस्ट ऑफ द डायोरेटिक ड्रग्स विल हैव पोटेशियम लॉस एज अ एडवर्स इफेक्ट. ठीक है, एक्सेप्ट पोटेशियम स्पेयरिंग डायोरेटिक. जो पोटेशियम स्पेयरिंग डायोरेटिक है वो पोटेशियम का लॉस नहीं करेंगे, लेकिन बाकी जितने भी डायोरेटिक्स है वो सब पोटेशियम को लॉस करते हैं. दैट इज अनडिजायर्ड बिकॉज पोटेशियम इज इम्पोर्टेंट कॉन्स्टिट्यूएंट, इम्पोर्टेंट मिनरल फॉर द body. Okay, so potassium is important. So it is not desired that a diuretic should cause potassium loss from the body. Okay, so untoward effect, so undesired effect produced by drugs, that is a potassium loss in diuretic. So are you getting it or not? Next one is a toxic effect. So what do you mean by toxic effect? Due to high dose of drug. For example, if you take a high dose of morphine, so it will cause respiratory depression. If you take a high dose of paracetamol for long term, so it can cause hepatotoxicity. That is known as a toxic effect. So side effect, untoward effect, toxic effect, these are the terminologies. Okay, next one is intolerance. Intolerance means failure to tolerate the drug. Suppose that you are taking a drug and your body is not accepting it. So your body is rejecting the drug. For example, आपने कोई ड्रग लिया तो आपको वोमिटिंग चालू हो गई या फिर आपको डायरिया हो गया. So that means your body is not accepting that drug. So your body is not tolerating that drug. That is what that's known as intolerance. Okay. So these are the consequences of adverse drug reaction. So adverse drug reactions may be either it may be either side effect, untoward effect, toxic effect, or intolerance. Let's see the type of adverse drug reaction. कितने type के होते हैं? So there are numerous type of adverse drug reaction given in the books. Whatever is important for GPAT, these are very important for GPAT. So first one is a type A. Types of adverse reaction, they are known as type A, type B, type C, type D, type E, and type F. So these are the types of adverse reaction. Adverse drug reaction. They are having synonyms and they are having different mechanism. Okay, we'll see it. So first type A adverse drug reaction. Type A for augmentation. A for augmentation. There is one trick to remember this. There is one trick to remember this type of adverse reaction. drug reaction. So type A is called as augmented or extension of pharmacological effect or action. So A for augmentation. Augmentation means extension. A for augmentation. Type B adverse drug reaction, they are known as a Beezer effect or idiosyncratic. So B for Beezer. Okay. Type C adverse drug reaction, they are known as a chronic. So C for chronic. Okay. Type D adverse drug reaction, they are known as a delayed type. So D for delayed. Okay. And type E adverse drug reaction, they are known as a after treatment effect. So E for effect. Okay. E for after treatment effect. Then type F adverse drug reaction, they are known as a type F is known as a failure of therapy. So F is for failure. Okay. So you can remember this action and their synonyms by just A for augmentation, B for bizarre, C for chronics, D for delayed, E for after treatment effect, F for failure of therapy. Type A adverse drug reaction, they are nothing but the extension of pharmacological action. Okay. For example, hypoglycemia caused by oral hypoglycemic drugs. Okay. So जितनी भी oral hypoglycemic drugs है, for example metformin, fenformin, then glipizide वगैरह etc. So you are taking this drug to decrease the blood sugar level. Okay, to decrease the blood sugar level, and if you increase the dose of drug, okay. So suppose that your physician has prescribed you a metformin 500 milligram twice a day. So you are taking metformin 500 milligram thrice a day or four times in a day. So that will obviously that will bring down your sugar level, okay, below the critical. So that is nothing but the extension of pharmacological action. Okay, and it is predictable and dose dependent. ठीक है, जैसे आप डोज बढ़ाओगे उतना ज्यादा हाइपोग्लाइसेमिया करेगा, उतना ज्यादा आपका शुगर लेवल कम करेगा वो ड्रग. Type A adverse drug reaction, they are known as augmented or extension of pharmacological action, and they are predictable and dose dependent. For example, hypoglycemia caused by oral hypoglycemic drug. Okay, clear? Now, type B adverse drug reaction, they are known as a Beezer effect or idiosyncratic effect. Okay, so idiosyncratic means they are unpredictable. So type B adverse drug reaction are unpredictable and डोज इंडिपेंडेंट. ठीक है, तो इसमें क्या होगा कि डजेंट मैटर डोज कितना है, 1 मिलीग्राम से भी आपको सीजर इफेक्ट मिल सकता है या इडियोसिंक्रेटिक इफेक्ट मिल सकता है, एडवर्स इफेक्ट, या फिर 10 मिलीग्राम से भी मिल सकता है, डजेंट मैटर, डोज इंडिपेंडेंट. सो टाइप 1 is the dose dependent, type 2 is a dose independent and unpredictable. You cannot predict what kind of adverse effect you will get these reactions. Okay, so they are mostly allergic reactions. They are mostly allergic and anaphylactic reactions caused by various drugs. For example, penicillin. So penicillin से बहुत सारे लोगों को allergic reactions होता है. For example, penicillins are not suited for each and every patient. Okay, that's why sometimes injection of penicillin will cause you anaphylactic reaction, and that anaphylactic reactions are nothing but a type B adverse drug reaction. तो कभी कभी क्या होता है कि आपको पेनिसिलिन का इंजेक्शन दिया, आपको पूछा नहीं कि आपको एलर्जी है वगैरह कुछ नहीं है, और आपको दे दिया, और अगर आपकी बॉडी ने वो एक्सेप्ट नहीं किया, तो आपकी बॉडी एलर्जिक रिएक्शन प्रोड्यूस करेगी. ओके, सो अगेंस्ट द पेनिसिलिन योर बॉडी विल प्रोड्यूस एलर्जिक रिएक्शन, and that is nothing but the type B adverse reaction, type B of adverse drug reaction, Beezer or idiosyncratic reaction. Okay, then type C known as a chronic effect. Type C is known as a chronic effect. Suppose that you are using a drug for a long period, that is chronic use of drug will result in the type C adverse drug reaction. For example, you may develop a peptic ulcer, you may develop an ulcer in your stomach, you may develop an ulcer in your intestine due to chronic use of these NSAIDs, non-steroidal anti-inflammatory drugs. So that is known as a chronic type of adverse drug reaction. Type D is known as a delayed type. Delayed type. Okay, they are not immediate. You will not observe immediate adverse drug reaction. They are delayed. Okay, so suppose that any pregnant woman take a thalidomide, or any pregnant woman take a valproic acid drug. Okay, for different elements, different condition. These drug may exert as a these drug may exert a teratogenic effect in the fetus. ठीक है, जैसे वेल्प्रिक एसिड अगर कोई प्रेग्नेंट वुमन में चालू किया, सो वैसे कॉन्ट्राइंडिकेटेड है, वो देना नहीं चाहिए, लेकिन दे भी दिया थैलिडोमाइड या फिर आपका वेल्प्रिक एसिड, सो इट विल कॉज अ teratogenic malformation in the fetus. Okay, so thalidomide will cause absence of limb, that is phocomelia. Then your valproic acid will cause, or sodium valproate will cause a neural tube defect in the fetus. So that is a delayed type of adverse drug reaction. Okay, delayed type of adverse drug reaction are nothing but the teratogenic effects of drug. Okay, they type E adverse reaction, they are known as a after treatment effect. Type E adverse drug reaction after treatment effect. Okay, for example, suppose that you are addicted to a particular drug, for example morphine. मॉर्फिन को आपको एडिक्शन हो गया मॉर्फिन का, और सडनली मॉर्फिन आपने मतलब मॉर्फिन का एग्जांपल ले लो या फिर आप अल्कोहल का एग्जांपल ले लो, ठीक है. सो सपोज दैट you are addicted to morphine or alcohol, okay, and you are taking alcohol since from 6 months. so you are consuming alcohol from 6 months डेली. डेली आपको एक क्वार्टर लग रहा है दारू का, ठीक है, और सडनली आपका वो क्वार्टर का ही छोपा दिया, ठीक है. सो सडन विड्रॉल ऑफ ड्रग, the body will respond to that, and that is nothing but the withdrawal symptoms. You will get withdrawal symptoms of drug. Whatever symptoms you are getting, that are nothing but the type E, that is after treatment effect. So sudden withdrawal of drug of abuse will result in the withdrawal symptoms. जैसे आपका sudden withdrawal of alcohol, अगर आप 6 महीने से दारू पी रहे हो और उसको आपको अचानक से बंद किया, क्या होता है कि you get a physical and a psychological विड्रॉल सिम्टम्स, कि आप आपके आंख से आंसू आएंगे, आप चिल्लाओगे, रोओगे, साइको जैसे बिहेव करोगे, आप खुद का सर पटक लोगे दीवार पे. So these are nothing but the withdrawal symptoms of drug abuse, and this kind of adverse effect they are known as the after treatment effect, type E adverse drug reaction. Now next one is type F adverse drug reaction. इतने सारे आपके एक बुक में नहीं दिए. Actually this table is made from extracting the different books. Okay, so type F adverse drug reaction, it is known as a failure of therapy. Okay, suppose that आपको बोला है कि if you are suffering from tuberculosis, and आपको डॉक्टर ने बोला है कि रिफॉम्पिसिन, इथाम्बुटोल वगैरह ये ड्रग आपको 2 months लेने हैं डेली कंटिन्यूसली फॉर 2 months. सपोज दैट आपने 10 days लिया और बाद में छोड़ दिया, आपका सिम्टम्स थोड़ा सा कम हो गया, आपने छोड़ दिया, disease will come again, relapse. Okay, relapse of disease. So that is known as a failure of therapy. Okay, type E of reaction, they are known as a failure of therapy. So just remember, type A adverse drug reaction are nothing but the augmented, type B are nothing but the bizarre, type C are nothing but the chronic, type D are nothing but the delayed, type E is nothing but the type E is nothing but the after treatment effects, type F is nothing but the failure of drug therapy, and C type B adverse drug reaction, here antigen antibody interaction is there. Okay, यहाँ पे क्या होगा कि penicillin says, for example, is a reaction में penicillin will act as an antigen in your body, and against that antigen your body will produce antibodies, and now antigen antibody reaction will result in the allergic reaction, inflammation, anaphylaxis. Okay, so type B or bizarre or idiosyncratic reactions, they are nothing but the unpredictable and dose independent antigen antibody reactions. Okay, remember classification of adverse drug reaction and their mechanism. Again, few adverse drug reactions are predictable, you can predict, आपको समझ में मुझे predict कर सकते हो. Few are unpredictable. Okay, so you cannot predict. So what are the unpredictable कौन से? For example, this extension of pharmacological action, so they are predictable. If you increase the dose, overdose, जैसे respiration depression caused by increased dose of morphine. आपको मालूम है कि अगर डोज इंक्रीज करेंगे मॉर्फिन का तो क्या होगा, रेस्पिरेटरी डिप्रेशन होगा, या फिर डोज इंक्रीज करेंगे इंसुलिन का तो हाइपोग्लाइसीमिया हो जाएगा. सो दोज आर द प्रेडिक्टेबल. नाउ अनप्रेडिक्टेबल यू कैन प्रेडिक्ट इट. फॉर एग्जांपल एलर्जिक hypersensitivity reaction, then cytotoxic or pseudo allergic reaction, then idiosyncratic or genetic mediated adverse drug reaction. So you cannot predict these kind of adverse effects. Okay, so in the allergic also you have different subtypes, type 1, type 2, type 3, type 4. So allergic reactions are also classified into different types. So type 1, they are known as immediate type of allergic reaction, type 2 is known as autoallergy, type 3 is known as a complement mediated allergic reaction, type 4 is known as a delayed type or cell mediated allergic reaction. Okay, so just remember the names of type 1, type 2, type 3, type 4. Now next one is what are the type 1 allergic reaction. ठीक है, so adverse drug reaction में एक टाइप होता है allergic drug reaction, allergic drug allergy, और उसमें भी 4 टाइप होता है, 4 टाइप्स ऑफ ड्रग एलर्जी. ठीक है, तो ऐसा मत कंफ्यूज मत होना कि Type 1 allergic reaction, type 2, type 3, type 4, they are nothing but the adverse type of adverse reaction. टाइप ऑफ एडवर्स रिएक्शन में ही एक टाइप है कि एलर्जिक रिएक्शन, उसमें भी सब टाइप्स है, फोर टाइप 4 allergic reaction. So we'll see what are the different type of allergic reaction. So first one allergic reaction, they are known as an immediate type of allergy. First one type of allergic reaction, they are known as an immediate type of allergy. Okay, so what happen in this case? So in this case, drug or any antigen or any allergen, so they will combine with the mast cell present in your body. तो मास्ट सेल में क्या होता है कि मास्ट सेल में आपका हिस्टामाइन होता है, ल्यूकोट्राइन, साइटोकाइनेस होता है. सो देयर विल बी रिलीज ऑफ हिस्टामाइन, ल्यूकोट्राइन्स, प्रोस्टाग्लैंडिन्स. व्हेन ए ड्रग और एलर्जन और antigen will combine with the mast cell, so it will release the histamine, leukotrienes and prostaglandin. These are the nothing but these are the chemicals, these are the autocoads, these are the hormones responsible for the your inflammation, pain and swelling. Okay, edema, inflammation, pain के लिए responsible होता है ये तीन, histamine, leukotriene and prostaglandin. So there will be vasodilation, edema and bronchoconstriction, severe or generalized anaphylaxis. So if both are there, vasodilation, edema, then pain, inflammation, bronchoconstriction is there, then they are known as a severe or generalized anaphylactic reactions. Okay. Then if they are only localized to a particular area, सिर्फ आपके स्किन के ऊपर ही रिएक्शन हो रहा है उसका, तो उसको बोलेंगे यूट्रिक एरिया. ओके, सो दैट इज लोकलाइज्ड. So allergic reaction may be either severe generalized anaphylaxis, for example in case of penicillins severe general anaphylaxis होता है, in case of sulfonamides local होता है यूट्रिक एरिया. Okay, so these are known as a type 1 adverse drug reaction, type 1 allergic reaction known as a immediate type allergic reaction. Now type second known as a autoallergy, type second known as a autoallergy. Now what happens in this case? A drug will convert tissue into host antigen. इसमें क्या होता है कि ड्रग जो लिया या फिर एंटीजन जो है, सो दैट एंटीजन और ड्रग विल बाइंड टू ए पर्टिकुलर टिश्यू प्रोटीन. जो आपके टिश्यू है, खुद के टिश्यू है, जो नॉर्मल है आपकी बॉडी के लिए, आपकी बॉडी के ही है, लेकिन आफ्टर बाइंडिंग ड्रग विद द टिश्यू, नाउ योर बॉडी विल ट्रीट दैट टिश्यू एज अ फॉरेन. आपका जो खुद का है टिश्यू, कोई सेल है या टिश्यू है या फिर कोई प्रोटीन है आपके खुद का, लेकिन नॉर्मली कुछ नहीं होता, लेकिन जब ड्रग आप लेंगे, ड्रग उस प्रोटीन के साथ में, उसी एंजाइम के साथ में या फिर उस टिश्यू के साथ में कंबाइन होने के बाद आपका टिश्यू कॉम्प्लेक्स, टिश्यू ड्रग कॉम्प्लेक्स और टिश्यू हार्मोन कॉम्प्लेक्स और टिश्यू एंजाइम कॉम्प्लेक्स, नाउ दिस कॉम्प्लेक्स इज recognized as a foreign by your body. Okay, and against that foreign antigen, against that drug tissue antigen, your body will produce antibodies, and again that once there is antibody production, antibody antigen reaction will be there, and there will be manifestation of disease like thrombocytopenia purpura, hemolysis can occur. So that is known as a autoallergy. For example, clomphenicol, methyl quinine, these kind of drug will show autoallergy. ठीक है, जैसे क्विनिन हो गया, क्विनिन क्लोपिन, that will combine with the retinal cell, it will cause allergic reaction. Clomphenicol is also there. Clomphenicol will combine with the bone marrow cells and all that. Methyl is also there. So these are the type second allergic reaction. They are known as autoallergy. Type 1 is known as the immediate type of allergic reaction. Now next one is a type 3 reaction. Type 3 allergic reaction. They are known as a complement mediated allergic reaction. So what happens in this? Drug will be treated as antigen, and against that antibody will be produced in the body, and drug antibody complex. Okay, now a drug antibody complex will be deposited in the wall of small vascular wall, in the wall of small vascular wall. Okay, then there will be मतलब जो भी blood vessel है उसमें deposit हो जाएंगे. So activation of complement जो allergic reaction होते हैं, antibody antigen complement reaction, वो reaction आ जाएंगे. So allergic inflammation of tissue, manifestation of disease, glomerulonephritis और serum sickness. तो इसमें क्या होता है कि ड्रग एंटीबॉडी कॉम्प्लेक्स, इसमें टाइप 3 रिएक्शन, टाइप 3 एलर्जिक रिएक्शन, दे आर नोन एज कॉम्प्लीमेंट मेडिएटेड एलर्जिक रिएक्शन. इसमें क्या होता है कि जो ड्रग है, ड्रग विल एक्ट एज एंटीजन, एंड ऑलरेडी आपके बॉडी में जो एंटीबॉडीज है, ऑलरेडी आपकी बॉडी में जो एंटीबॉडीज है उसका कॉम्प्लेक्स बन जाएगा और वो कॉम्प्लेक्स डिपॉजिट होगा तो भी टिश्यू में. ओके, फॉर एग्जांपल ब्लड वेसल में या फिर में, ठीक है. सो एक्टिवेशन ऑफ कॉम्प्लीमेंट एंड एलर्जिक इन्फ्लेमेशन इन द टिश्यू. फॉर एग्जांपल ग्लोमेरुलोनेफ्राइटिस, ग्लोमेरुलो का इन्फ्लेमेशन करेंगे. ग्लोमेरुलोनेफ्राइटिस एंड सीरम सिकनेस caused by various kind of drugs. So that is a type of type 3 allergic reaction, that is a complement mediated. Now type 4, they are known as a delayed or cell mediated allergy. Delayed or cell mediated allergy. Cell mediated मतलब T cell or B cell lymphocytes or MS derived lymphocytes. What happens in this? So drug will activate the T lymphocyte. Drug will activate the T lymphocyte and immediately local manifestation like allergy, that is contact dermatitis and idiosyncrasy. So it is genetically mediated. So type 4 allergic reaction are genetically mediated, and that's why type 4 reaction, allergic reaction, they are known as idiosyncratic reaction. It is genetically determined abnormal reactivity to the chemical, which means person, which means basic, इसमें क्या होता है कि the basic defect lying with the abnormal functioning of particular enzyme due to patient following the administration of some particular drugs. For example, जैसे आपका होता है कि बहुत सारे जो लोग जैसे अमेरिकन्स होते हैं, जैसे देर आर डिफरेंट रेसेस ऑफ ह्यूमन, अमेरिकन्स, निग्रोज, इंडियंस, ठीक है. सो दीज आर द रेसेस. सो इफ देर इज अ पर्टिकुलर, निग्रोज में क्या होता है कि पर्टिकुलरली ग्लूकोज 6 फॉस्फेट डीहाइड्रोजिनेज नाम का एक एंजाइम होता है, वो डिफिशिएंट होता है. सो दोज पेशेंट who are deficient in the glucose 6 phosphate dehydrogenase G6PD. So those patients who are deficient in the enzyme glucose 6 phosphate dehydrogenase, and if you treat such a patient with the drugs like your Primaquine, nalidixic acid, okay, so there will be hemolysis, or there will be hemolysis in the this patient. If you patient suffering, patient deficient in the glucose 6 phosphate dehydrogenase enzyme, जिनमें ग्लूकोज 6 फॉस्फेट डीहाइड्रोजिनेज एंजाइम का डिफिशियंसी है या फिर प्रोड्यूस नहीं होता है, ओके. सो नाउ कैसे प्रोड्यूस होगा वो, उसके लिए एक जीन रिस्पॉन्सिबल होता है. सो फॉर द प्रोडक्शन ऑफ ग्लूकोज 6 फॉस्फेट डीहाइड्रोजिनेज एंजाइम देयर इज वन जीन रिस्पॉन्सिबल टू जेनेटिक डिफेक्ट इन सम पीपल. फॉर एग्जांपल निग्रोज में क्या होता है कि ग्लूकोज 6 फॉस्फेट डीहाइड्रोजिनेज का डिफिशियंसी होता है, उसमें वो जीन कम होता है, तो प्रोडक्शन ऑफ ग्लूकोज 6 फॉस्फेट डीहाइड्रोजिनेज विल बी लेस. If such patients are treated by Primaquine or nalidixic acid or quinidine, so there is a result of hemolysis, उनका breakdown होता है, ठीक है. So such kind of reactions, they are known as idiosyncratic reactions or type 4 or delayed or cell mediated allergic reaction. okay. उसमें क्या होता है, deficiency mechanism क्या होता है, इसमें mechanism कैसे होता है वो hemolysis. So those patients who are deficient in the glucose 6 phosphate dehydrogenase deficiency in the RBC, इसमें मैकेनिज्म है ग्लूटाथायोन रिडक्शन इज नॉट. तो उसमें क्या होता है कि ग्लूकोज 6 फॉस्फेट डीहाइड्रोजिनेज इज रिस्पांसिबल फॉर द जनरेशन ऑफ ग्लूटाथायोन, ग्लूकोरिक एसिड, ग्लूकोयूरोनिक एसिड, ग्लूटाथायोन. सो दैट इज यूज्ड, that is produced by glucose 6 phosphate dehydrogenase, and if there is deficiency, so glutathione will not be there in the glutathione production will not be there in the RBC. okay, so this is very important for iron and hemoglobin. ग्लूटाथायोन का रिडक्शन अगर नहीं होगा तो जो आपका ब्लड में हीम आयरन इन द हीमोग्लोबिन टेंड्स टू बिकम फेरिक. नॉर्मली फेरस होना चाहिए. नॉर्मली व्हाट हैपेंस, बिकॉज ऑफ फेरस is ferric is the reduced form of ferrous. okay, तो कैसे होता है रिडक्शन, बिकॉज ऑफ ग्लूटाथायोन रिडक्शन. ओके, एंड ग्लूटाथायोन नहीं है, क्यों नहीं है, क्योंकि उसमें सॉरी ग्लूकोज 6 फॉस्फेट डीहाइड्रोजिनेज का डेफिशिएंसी. सो ग्लूकोज 6 फॉस्फेट डीहाइड्रोजिनेज डेफिशिएंसी will result in the glutathione reduction, less glutathione reduction. okay, and because of that ferrous will not be converted into ferric. okay, and once it become ferric, so it become useless. तो हीमोग्लोबिन में फेरस ही चाहिए. अगर फेरिक है तो हीमोग्लोबिन इज यूजलेस. if it is useless, then obviously body will destroy it. So then RBC become susceptible for oxidant drug and subject develop a hemolytic anemia. So those patients who are deficient in the glucose 6 phosphate dehydrogenase enzyme, and if you treat those patients with the Primaquine, nalidixic acid or quinine antibody, so that result in the hemolytic anemia. So these are nothing but the type 4 for or delayed or cell mediated type of allergic reaction. Okay, I will see the next is drug not recommended for or contraindicated for the use of breastfeeding or lactating women. मतलब these are the example of drug which are not recommended, which are not used, which should not be used in the lactating women or breastfeeding mothers. जो माता आपके बच्चे जो माता बच्चे को दूध पिला रही है, अपने खुद का दूध, शरीर का दूध. So you know that we have seen in the last lecture there are certain drugs which are excreted in the milk. Okay, so those drugs which are secreted or excreted in the milk, they should not be administered in the pregnant and lactating woman. Okay, so what are the example of these kind of drugs? So antibacterial drugs or antibiotics like sulfonamide, tetracycline, chloramphenicol, nalgesic acid, then isoniazid, erythromycin. So these kind of antibiotics they used to secreted in the milk and they can adversely affect the fetus. जो ब्रेस्ट फीडिंग होता है, जो मिल्क लैक्टिंग वुमन होता है, उनमें अगर ये ड्रग देंगे तो वो ये ड्रग क्या होंगे, मिल्क में सीक्रेट हो जाएंगे और वो एडवर्सली इफेक्ट करेंगे आपको. Analgesic drug like indomethacin, phenylbutazone, aspirin, opioid analgesic. So these are also secreted in the milk. And psychoactive drug are diazepam, lithium carbonate. These also secreted in the milk. That's why. So you should not administer these drug in the lactating woman. तो lactating woman में ये contraindicated होता है. So antihypertensive drug like reserpine, clonidine, antithyroid drug like thiuracil, methimazole, then carbamazole, radioiodine, antineoplastic drugs and like amantine, cimetidine, anthraquinone, glycosides, then amiodarone, ephedrine. So these kind of drugs they should be avoided in the pregnant woman or lactating woman, particularly breastfeeding and lactating woman. So these drugs should be contraindicated. Suppose that you got a poisoning, and for that, if you got a poisoning, there are certain antidotes available for a particular poison. But if you don't know the nature of poisoning, अगर आपको poison को किस वजह से हुआ है इसका मालूम नहीं है, if you don't know the nature of poisoning, in that case you have to administer universal antidote. If you don't know the nature of poisoning, अगर आपको poison के बारे में कुछ भी मालूम नहीं है लेकिन आपके पास सामने पेशेंट पड़ा है तो उसको वैसे मरने नहीं दे सकते. So you have to use universal antidote. So what is antidote? Antidote is nothing but the counteracting drug for the particular poisoning. Okay, so if you don't know the nature of poison, you have to use universal antidote, and universal antidote is nothing but the it is made up of two parts of activated charcoal powder, one part of tannic acid and one part of magnesium oxide. याद रखो कंपोजिशन उसका यूनिवर्सल एंटीडोट का कंपोजिशन क्या है, charcoal, activated charcoal, tannic acid and magnesium oxide. Okay, now what is the role? Activated charcoal will act as an adsorbent for unabsorbed poison. Okay, most of the time जो poisoning होता है, ये जो poisoning होता है most of the time ये, and universal antidote was designed when there was no specific antidote. Okay, तो मोस्ट ऑफ द मान लीजिए सपोज दैट आपका अगर पॉइजनिंग हो गया अल्कोलाइड से. ओके, सो अल्कोलाइड से अगर पॉइजनिंग हुआ है, सो दिस टैनिक एसिड विल रिएक्ट विद अल्कोलाइड एंड विल प्रेसिपिटेट. So precipitated form of alcohol will not be absorbed from your stomach. Okay, so this powder charcoal will absorb the drug. This tannic acid will precipitate the your alkaloids. This magnesium oxide will magnesium oxide again will act as a will react with chemically. That's how universal antidote will be beneficial in case of poisoning. So tannic acid can precipitate alkaloids, therefore used in the alkaloid poisoning. So universal antidote is mostly used in case of this alkaloid poisoning. Okay, drug tolerance. What do you mean by drug tolerance? So that drug tolerance मैं थोड़ा सा आपको explain करूँगा. So if large dose of drug is required to elicit a effect which is ordinarily produced by normal dose, that is known as a tolerance. अगर मान लीजिए कि आपको जैसे होता है ना, आपको थोड़ा सा हेडेक होता है, सो हेडेक होता है तो आप क्या करते हो, कॉफी लेते हो, कॉफी एक कप कॉफी पीएंगे तो आपको थोड़ा सा रिलीफ मिलेगा. ठीक है, लेकिन कुछ कुछ महीने तक आप ऐसे ही करते रहोगे तो वो हेडेक आपका एक कप कॉफी से नहीं जाएगा, वो हेडेक जाने के लिए आपको 2 कप कॉफी लगेगी. दैट मीन्स you are getting a you are not getting a desired pharmacological effect by same dose. So if more dose is required to get a desired pharmacological effect, that means you are becoming टॉलरेंट टू दैट ड्रग। ठीक, जैसे मान लीजिए कि होता है ना, जैसे ड्रिंकिंग जिनको है, ड्रिंक ड्रिंक जो करते हैं, सो सपोज दैट यू आर फर्स्ट टाइम ड्रिंकिंग एनी ब्यूरेज, सपोज दैट यू आर फर्स्ट टाइम ड्रिंकिंग एनी अल्कोहल। सो एक बार में क्या, अगर आपने एक 30 ml का पैक ले लिया अल्कोहल का, तो आपको उसी में आपको पूरा आप मतलब पूरा टुल हो जाओगे। ठीक है, अगर 2-3 बार आपने वो वैसे ही किया, मतलब हैबिट लग गई आपको, इट्स ओके। तो नेक्स्ट टाइम क्या होगा कि आपको 1 पैक अगर लेंगे आप, तो उसमें कुछ नहीं होगा आपको, मतलब यू विल बिकम ओके, आप नॉर्मल लोगे। 2 पैक 3 पैक लेंगे फिर भी नॉर्मल लोगे। ठीक है, सो टूल होने के लिए आपको पहली बार में 1 पैक काफी था, दूसरी बार में आपको 2 पैक लगा, तीसरी बार में 3 पैक लगा। सो दैट मीन्स यू आर बिकमिंग टॉलरेंट, you are becoming tolerance, your body is becoming tolerant to that drug. Okay, so if large dose of drug is required to elicit or to generate pharmacological effect, which is normally produced by normal dose, so this is known as a drug tolerance. Okay, this is known as a drug tolerance. So it may be either natural tolerance or it may be either acquired tolerance. Okay, so natural tolerance कैसे होता है? natural कि देखो, example, species tolerance. So natural tolerance is a species tolerance. जैसे अपन humans है, जैसे rabbits होते हैं, जैसे pigs होते हैं, dogs होते हैं, so they are also animals. So species, animal का species होता है, dogs dog है, जैसे dog हो गया, horse हो गया, या फिर cattle हो गया, या फिर humans हो गए. So some rabbits are naturally tolerant. Rabbits are naturally tolerant for the belladonna or for the atropine. So they require a high quantity of atropine to dilate their pupils. Okay, so some rabbits are naturally tolerant for the atropine. Okay, so that is nothing but the species tolerance. Okay, but humans are not tolerant. Humans में वही डोज दिया तो डायलेशन हो जाएगा पिपिल का, लेकिन रैबिट में अगर वो डोज दिया तो उतना डायलेशन नहीं होगा, उनके लिए ज्यादा डोज लगेगा. That is known as a species tolerance. Okay, because there are the rabbits which has a enzyme atropine esterase. Atropine esterase नाम का एंजाइम उनमें होता है, so atropine का मेटाबॉलिज्म करता है. So that's why rabbits are more tolerant, they are more tolerant to the atropine because of presence of this enzyme. Again, black people, mytrisis, जो निग्रोज पीपल होते हैं आपके निग्रो, so they are also tolerant to the atropine, so as compared to our white people or Indian. ठीक है, जो निग्रोज होते हैं, ब्लैक पीपल होते हैं, वो थोड़ा सा टॉलरेंट होते हैं उसके लिए, एट्रोपिन के डायलेशन के लिए, एट्रोपिन के लिए. देन आवर that is known as a species tolerance. Now next one is the racial tolerance. Racial tolerance. ओके, इसके बारे में जीपैट 2019 ने क्वेश्चन पूछा था, एज इट इज. सो रेशियल टॉलरेंस, सो फॉर एग्जांपल एट्रोपिन solution is still into conjunctival check of Caucasians produces dilation of pupil, but in Negroes it may not produce any dilation at all. So this is known as a racial tolerance. अगर देखो, अपन भी animals, अपन we are also a species, human species. Okay, rabbit, animals. So there is a special tolerance between the species. They are known as a spatial tolerance. जो species है, ठीक है, जो race है, race जैसे अपन humans है, humans में different race होता है. ठीक है, जैसे Americans, Negroes, then Russians, then here Indians. Okay, जैसे Chinese लोग हैं. So we are humans, but we are having different race. Okay, particular drug is able to produce particular action in Chinese, and if Indians are in, in Indians more dose is required. That is known as racial tolerance. For example, here atropine can cause dilation in the pupil in Caucasian people, but not produce dilation in the Negroes. Okay, so that is known as a racial tolerance, and this was a question in GPAT 2019. इसमें GPAT में क्वेश्चन आया था ये. So if ये ऐसा ही क्वेश्चन था, atropine installation in the conjunctival sac of Caucasian people will produce dilation, but will not produce in the Negroes. So it is known as racial tolerance, species tolerance. ऐसा था. Next is a cross tolerance. Cross tolerance. So if you are become a tolerant to a particular drug, and if you take another drug of same category, okay, or same chemical class, then you become tolerant to that drug also. So that is known as a cross tolerance. So tolerance for a group of similar class of drug. For example, tolerance between alcohol and general anesthetic, ether, okay. Then tolerance to antibiotics, okay. So if you are tolerant to alcohol, okay, so you become tolerant for ether, because ether and alcohol little bit having similar structure. So if you are tolerant to alcohol, so you will become tolerant to ether. So large dose of ether is required to induce the anesthesia. So if you are tolerant to penicillins, so if you are tolerant to penicillins, you may become tolerant to cephalosporin, because these two antibiotics have similar structure. Okay, so large dose of penicillins, if you require large dose of penicillins, then you require a large dose of your cephalosporins also. So that is known as a cross tolerance. So tolerance, you have to remember drug tolerance. What is drug tolerance? What is species tolerance? What is racial tolerance? What is cross tolerance? And next one is tachyphylaxis. Now tachyphylaxis, okay. Now this kind of tolerance to develop it require time. ये टॉलरेंस डेवलप होने के लिए आपको टाइम लगता है, ठीक है। जैसे मान लीजिए कि आपने आज एक पैक ड्रिंक किया, अल्कोहल एक पैक ले लिया, तो आज के आज ही आपको टॉलरेंस नहीं मिलेगी। तो आपने अगर कल ले लिया, परसों ले लिया, 15-20 दिन तक आपने कंटिन्यूस ड्रिंक किया, तो आपको थोड़ा सा टॉलरेंस डेवलप हो जाएगा। मतलब आज जो आपके वन पैक में आपको टूल हो जाते थे, 15 दिन के बाद एक पैक में टूल नहीं हो गया, ठीक है। 15 दिन के टूल होने के लिए आपको 15 दिन के बाद 2 पैक लगेंगे, ठीक है। महीने के बाद 3 पैक लगेंगे। तो ऐसा द टॉलरेंस डेवलप स्लोली to the drugs. So drug tolerance normally takes time to develop. But if any drug is able to develop a tolerance within a minute, ठीक है, if any drug is developed, any tolerance to any drug develops within a minute or within a hour, that is known as a tachyphylaxis. So certain drugs develop a tolerance within a few minutes. On the other hand, tolerance takes time to develop. Okay, for example, ephedrine का tolerance आपको कुछ मिनट में ही हो जाएगा। सो इपेड्रीन, टायरामाइन, एम्फेटामाइन, 5-hydroxyamphetamine, 5-hydroxytryptamine show the tachyphylaxis. So rapid tolerance, okay. So tolerance to the ephedrine, tyramine, amphetamine, 5-hydroxytryptamine can develop in a within a few minutes, and that is known as a tachyphylaxis or acute tolerance. It is also known as acute tolerance. So if tolerance to the drug develops within a minute, that is known as a tachyphylaxis. Again, this was a question in GPAT. Okay, so you remember this, what is meant by tachyphylaxis, what is racial tolerance, what is cross tolerance, what is species tolerance. Okay. 2 बार क्वेश्चन आ चुका है, एक बार रेशियल टॉलरेंस पे क्वेश्चन आया था, एक बार tachyphylaxis पे क्वेश्चन आ चुका है, and you should know the composition of different composition of universal antidote. जैसे 2 part of charcoal, 1 part of tannic acid, 1 part of magnesium oxide. ये क्वेश्चन भी बहुत बार फार्मासिस्ट के एग्जाम में पूछा है, व्हाट इज कंपोजिशन ऑफ यूनिवर्सल एंटीडोट. There are certain terms like additive effect, summation, then synergistic effect. Okay, so additive effect means what? So when total pharmacological action of 2 or more drug administered together is equivalent to the sum of individual pharmacological response, is known as additive effect. ठीक है, कि मान लीजिए आपने 2 ड्रग ले लिए, ठीक है, और आपको इफेक्ट जो मिल रहा है उनका एडिशन करके इफेक्ट मिल रहा है. जैसे फॉर एग्जांपल, इफ यू कंबाइन योर and paracetamol, if you combine caffeine और paracetamol, so you are getting 1+1 effect. caffeine का इफेक्ट मिल रहा है और इसका paracetamol का इफेक्ट मिल रहा है, headache. So that is known as additive effect. Okay, for example, paracetamol, aspirin for pain. Okay, so if you combine paracetamol and aspirin, so you will get a effect 1+1. Okay, that is known as a additive effect or summation. Now next one is a synergistic effect. Now facilitation of pharmacological response by combination use of 2 or more drugs. Okay, तो यहाँ पे क्या होगा, मान लीजिए पैरासिटामोल का एक्शन एक है, ऐसा एस्पिरिन का एक है, 1+1 2 ही मिल रहा है आपको, ठीक है। लेकिन यहाँ पे मान लीजिए कि एक ड्रग का एक्शन मिल रहा है आपको 2, दूसरा का मिल रहा है आपको 2, 2+2 4 होना चाहिए नॉर्मली, बट यहाँ पे अगर extension or facilitation of pharmacological response by combined use of 2 or more drugs, you are getting synergistic effect. That is known as synergistic effect. So 2+2 is equal to 5. Normally 4 होता है, लेकिन synergistic effect means 2+2 is equal to 5. So for example, sulfamethoxazole and trimethoprim. ठीक है, अगर आपने सिर्फ sulfamethoxazole यूज किया alone, so it is antibacterial drug. It will inhibit the folic acid synthesis at a one step. Okay, it will also kill the bacteria. And trimethoprim is another another drug that will also kill the bacteria, but by the same mechanism. But if you use these two drug in a combination, so there is a sequential block of folic acid synthesis by inhibiting. Okay, so sulfamethoxazole will inhibit the formation of dihydrofolic acid. Okay, and trimethoprim will inhibit the formation of tetrahydrofolic acid. Okay, means normally क्या होता है कि फॉलिक एसिड डायहाइड्रोफोलिक एसिड बनता है, उसके बाद में टेट्राहाइड्रोफोलिक एसिड बनता है, और बाद में जो टेट्राहाइड्रोफोलिक एसिड है that is important for metabolism of bacteria, one carbon atom chain. So sequential block of synthesis of folic acid is done by this combination. Now जो आपको सल्फामेथाजोल अगर सिंगल यूज करेंगे जो इफेक्ट मिलने वाला था, और ट्राइमेथोप्रिम अगर सिंगल यूज करेंगे उसके बाद में जो इफेक्ट मिलने वाला था, अगर ये दोनों को कंबाइन करते हैं तो वो इफेक्ट मल्टीप्लाई होता है. So multiplication of pharmacological action will be there. Okay, so that is 2 plus 2 will become 5 in the synergistic effect. Okay, so remember what is additive effect or synergistic effect. Now next one is, for example, codeine and aspirin for pain. और कोडिन एस्पिरिन अगर साथ में देंगे तो वो पेन जो है आपका वो जल्दी रिलीव हो जाएगा. कोडिन एंड एस्पिरिन फॉर पेन. सो एक्सटेंशन or facilitation of pharmacological response by combination of two or more drugs, that is known as synergistic effect. Now specific antidotes for certain poisoning. ठीक है, so अगर if you got a overdose of paracetamol, so paracetamol का overdose हो गया या फिर poisoning हो गया paracetamol का, so in that case which kind of antidote is there? Specific antidote is N-acetylcysteine. N-acetylcysteine is a specific antidote for paracetamol. Remember इसके बारे में 2-3 बार क्वेश्चन पूछा है. Then again methionine is also there. Methionine क्या है? It is a amino acid, sulfur containing amino acid, methionine. ठीक है. Now what's happened? paracetamol का overdose हो गया ना, तो अब क्या होता है कि paracetamol का overdose होने के बाद there is a generation of metabolite of paracetamol, that is N para-hydroxyphenamine, naphthoquinone, N-acetyl para-hydroxyphenamine, NPQI. Okay, N-acetyl para-hydroxynaphthoquinone. So that is a reactive metabolite of paracetamol. वो मेटाबोलाइट क्या करता है कि आपके हेपेटिक सेल के साथ में कंबाइन होके वहाँ पे नेक्रोसिस करेगा. सो दैट मेटाबोलाइट ऑफ पैरासिटामोल इज अ hepatotoxic, and hepatotoxicity of paracetamol is because of that metabolite only. Okay, now वो मेटाबोलाइट का क्या होता है? नॉर्मली वो मेटाबोलाइट नहीं बनता है आपकी बॉडी में. नॉर्मल अगर थेरेपेटिक डोज में अगर पैरासिटामोल लेंगे आप, so there will be no generation of the toxic metabolite, because क्या होता है कि नॉर्मली आपके बॉडी में ग्लूटाथायोन एक रहता है, जैसे ग्लूकोनिक एसिड होता है, ग्लूटाथायोन होता है. सो पैरासिटामोल एंड इट्स मेटाबोलाइट दे आर एक्सक्रीटेड फ्रॉम द बॉडी बाय कॉन्जुगेशन रिएक्शन. ओके, ग्लूटाथायोन के साथ में कॉन्जुगेशन होता है उसका और वो मेटाबोलाइट एक्सक्रीट होता है. बट नॉर्मली इट हैपेंस नॉर्मली. नाउ इफ यू गॉट अ ओवरडोज ऑफ पैरासिटामोल, सो देयर विल बी ओवर प्रोडक्शन ऑफ एनपीक्यूआई, para-hydroxynaphthoquinone metabolite. So this metabolite will be produced in a large quantity in the body. So glutathione जो है आपका conjugation के लिए, so that is limited. So now because of that limitations, glutathione limitation, so you deliver toxicity. Okay, now to replace that glutathione, so this N-acetylcysteine and methionine, they are sulfur containing amino acid. They will increase the production of glutathione. They will make glutathione available for excretion or conjugation. So that's how this drug will act. Okay, N-acetylcysteine and methionine. If you got poisoning of mercury, arsenic, and copper, then BAL, British Amebicide, British Amebicide leviside. It is a chemical antidote. Okay, for mercury, arsenic, and copper. Then if you got poisoning due to atropine and other cholinergic antagonists, then physostigmine is the antidote. Physostigmine is a cholinesterase. It is a cholinesterase activator. Carbon monoxide. If you got poisoning of carbon monoxide, in that case oxygen is a antidote. साइनाइड का पॉइजनिंग अगर हो गया तो आपको यहाँ पे एंटीडोट कौन सा है? डाइकोबाल्ट DDA और अमाइल नाइट्रेट. then it is followed by sodium nitrite and then sodium thiosulfate. Sodium nitrite, sodium thiosulfate is a combination used in the treatment of cyanide poisoning. Then amyl nitrate or dicobalt EDTA is also a drug, specific antidote for cyanide poisoning. in methanol and ethylene, methanol or ethylene glycol poisoning. In case of this ethanol is a drug specific antidote. Ethanol is a specific antidote. So in case of methanol poisoning, ethanol or 4-methyl-pyrazole, they are the specific antidote. In case of lead poisoning, calcium EDTA, calcium disodium EDTA or dimarcaptosuccinic acid, dimarcaptosuccinic acid is a specific antidote. In case of nitrite poisoning, methylene blue is a एंटीडोट. इसमें एंटीडोट और पॉइजनिंग एंड एंटीडोट ये इंपॉर्टेंट है. इसमें इसके ऊपर बहुत बार क्वेश्चन आ चुके हैं जीपैट में या फिर वेरियस काइंड ऑफ एग्जाम में. ठीक है. सो ये चार्ट मेरे बुक में भी है, यू कैन रीड फ्रॉम बुक आल्सो. अगेन इन केस ऑफ ओपाइड पॉइजनिंग नैलोक्सोन. ओके, इन केस ऑफ ओपाइड पॉइजनिंग नैलोक्सोन इज द स्पेसिफिक एंटीडोट. इसके बारे में बहुत बार क्वेश्चन आया. ओपाइड पॉइजनिंग, व्हाट इज द स्पेसिफिक एंटीडोट फॉर ओपाइड पॉइजनिंग. ओपाइड मतलब मॉर्फिन, कोडीन, हेरोइन वगैरह. So opioid drug naloxone is a specific antagonist. Okay. Then again, in case of benzodiazepine poisoning, flumazenil is a specific antidote. So benzodiazepine क्या है? They are the GABA receptor agonist, and flumazenil क्या है? It will block the GABA receptor. That is flumazenil. Then organophosphorus poisoning में आपका specific antidote है praliloxime. So praliloxime is a cholinesterase activator. Okay, praliloxime. So atropine भी यूज करते हैं, but atropine is not that much of specific antidote for organophosphorus compound. But praliloxime is a specific antidote. So antidote for heparin poisoning or heparin overdose is a protamine sulfate. Yeah, this we have seen in the previous lecture also. When we were discussing coagulant and anticoagulant, उसमें ये बोला था मैंने. ठीक है. If you got a overdose of tricyclic antidepressant, TCA, tricyclic antidepressants like imipramine, then desipramine, etc. Phenothiazines. Sodium bicarbonate is a antidote. If you got poisoning due to if you got a poisoning due to ethylene glycol poisoning का specific antidote है fomepizole. So fomepizole is a specific antidote for ethylene glycol poisoning. Okay. Ethanol is also sometimes used. एंड मिथेनॉल का ओवरडोज हो गया. सो मिथेनॉल का अगर ओवरडोज हो गया, सो इथेनॉल इज अ स्पेसिफिक एंटीडोट. आप बोलेंगे सर कैसे? सपोज दैट मिथेनॉल का पॉइजनिंग क्यों होता है? व्हाई देयर इज अ पॉइजनिंग ऑफ मिथेनॉल? सो समटाइम्स व्हाट हैपेंस ड्यू टू कंजप्शन ऑफ क्रूड अल्कोहल. क्रूड अल्कोहल जो होता है आपका, जैसे गांव में बनता है ना कि देसी पीते हैं जब, मतलब वो आप फर्मेंटेशन लोकली फर्मेंटेशन करके वो अल्कोहल बनाते हैं. ठीक है, गावठी बोलते हैं इसको. सो गावठी जो अल्कोहल है वो अगर आपने पिया तो उसमें क्या होता है कि बिकॉज ऑफ इम्प्रॉपर क्लैरिफिकेशन, इम्प्रॉपर फर्मेंटेशन, इम्प्रॉपर सेपरेशन, सो दे डेवलप some amount of methanol in the ethanol, and methanol is very poisonous drug. Okay? Ethanol poisonous. Okay. Now when we will see the alcohol chapter, at that time also I will tell you why ethanol is used in case of methanol poisoning. But just remember, ethanol and methanol has a similar structure, and ethanol will compete with the methanol for receptor or for metabolism. So that's why symptoms will be released. So ethanol is used in case of methanol poisoning. ठीक है. तो वो जो रॉ जो देसी गावठी दारू होती है उसमें कभी कभी मिथेनॉल का जनरेशन हो जाता है. और आपने सुना होगा कि बात अपने पेपर में भी सुना होगा कि गावठी दारू पीने से 10 लोगों की मौत, 20 लोगों की मौत. व्हाई? बिकॉज ऑफ दैट गावठी दारू में मिथेनॉल का कंपोजिशन आ जाता है. नाउ नेक्स्ट ड्रग इज आइसोनियाजाइड. सॉरी, नेक्स्ट ड्रग इज iron. It is not isoniazide, iron. So in case of iron poisoning, diphenhydramine is a specific antidote. It is a chelating agent for iron. It is not isoniazide. यहाँ पे iron है, यहाँ पे spelling mistake हुआ है मेरे से. ठीक है. Then इंसुलिन का ओवरडोज अगर हो गया तो उसमें ग्लूकोज यूज करना है. अगर किसी ने 2-3 इंजेक्शन इंसुलिन का ले लिया और उसका हाइपोग्लाइसेमिया हो गया, so if insulin overdose is there, so it will result in the hypoglycemia. So patient will die due to hypoglycemic shock. Okay. अगर ब्रेन को शुगर नहीं मिला आपको ग्लूकोज, so brain will die. So in case of insulin overdose, you have to inject the alcohol. डायरेक्टली क्या करना है, उसको सलाइन लगा देने का है. D5 डेक्सट्रोज 5% का सलाइन लगा दो, वो क्लियर हो जाएगा. ओके. या फिर आप डायरेक्टली ग्लूकोज भी दे सकते हो ओरली. In case of calcium channel blocker, if you got a overdose of calcium channel blocker or poisoning of calcium channel blockers, calcium, then glucagon, they are used as an antidote. If you got a overdose of aspirin, sodium bicarbonate is given. Why sodium bicarbonate is given? Because see, sodium bicarbonate is a base. Okay, aspirin is a weak acid, and I have told you in the last lecture when we were discussing the excretion. So excretion of weak acid can be increased by alkalization of urine. Excretion of weak basic drug can be increased by acidification of urine. So that's why this sodium bicarbonate is used as an antidote for aspirin. If you got a overdose of beta blockers, physostigmine is the drug. These antidotes are very important. So again, if you got a poisoning or a overdose of beta blockers, then physostigmine is a specific antidote. If you got a poisoning of hydrofluoric acid, calcium gluconate is the antidote. If you got a overdose of methotrexate, leucovorin is the antidote. And if you got a overdose of anticoagulant or coumarin, vitamin K is the antidote. Okay, so इसमें विटामिन के बारे में, इपेरिन के बारे में सब एंटीडोट्स इंपॉर्टेंट है, ऑलरेडी पूछा है एग्जाम्स में. Now next one is a drug and their specific adverse effect. Few drugs have a specific adverse effect. For example, hepatotoxicity is caused by this drug: isoniazid, pyrazinamide, paracetamol, chlorpromazine, 6-mercaptopurine, halothane, ethanol, and phenylbutazone. So hepatotoxicity will be caused by this kind of drug. Then nephrotoxicity means toxicity to the kidney or nephron. So analgesic drug, aminoglycoside, cyclosporine, silastine, cephaloxime, penicillamine, gold salt, they will cause nephrotoxicity. आपने देखा होगा कि बहुत बार सुना होगा आपने कि अगर पेन किलर ज़्यादा खाओगे तो किडनी खराब हो जाएगी. अगर ज़्यादा पेन किलर खाओगे तो किडनी खराब हो जाएगी. Why? Because analgesic drug वो aminoglycosides, cyclosporine, then cisplatin or platinum salt or any gold salt, they will cause nephrotoxicity. They are toxic to specific toxicity caused by drug. Okay. Then again, few aminoglycosides and furosemide, they are ototoxic. They will damage your eighth cranial nerve. So ototoxicity will be caused by aminoglycoside and furosemide. Then you will become deep. Then ocular toxicity is caused by chloroquine ethambutol. GIT में toxicity कौन करेगा? ओपाइड ब्रॉड स्पेक्ट्रम एंटीबायोटिक. then cardiovascular system को toxic कौन है? digoxin, doxorubicin. So these respiratory system को toxicity कौन करेगा? aspirin, bleomycin, busulfan, amiodarone, methotrexate. They will cause respiratory acidosis. Is skeletal-muscular system को corticosteroid and heparin, they will bind and cause toxicity. Neurological toxicity is because of isoniazid, peripheral neuropathy. Then you have haloperidol, ethambutol, quinine, doxorubicin, vincristine. So these are the drugs, they can cause specific toxicity. ये याद रखो. बाकी you can read this chart from book. So this is an example of teratogenic drugs. कौन से teratogenic drug है? So methotrexate will cause teratogenicity. It will cause limb malformation in the pregnant woman. If you take a methotrexate in pregnant woman, so limb malformation or CNS malformation will be the teratogenic effect in the fetus. ACE inhibitors will also cause teratogenicity. So ये भी चार्ट मेरे बुक में आप पढ़ सकते हो. ऐसे पढ़ के दिखाने में कोई मतलब नहीं. So drug causing ototoxicity. So ये भी है. So toxicity of drug or the study of toxicity of drug is known as toxicology. Okay, ये last point है general pharmacology में से toxicology. So study of adverse effect or study of toxic effect of drug is known as a toxicology. Okay, so aminoglycosides will cause aminoglycosides, macrolide, loop diuretics will cause ototoxicity. Antimalarial drugs like quinine, chloroquine will cause ototoxicity. Anti-cancer drug like bleomycin, cisplatin, they also have ototoxicity. They will damage your eighth cranial nerve, causing deafness. Okay? Eardrop like clonpenicol, polymyxin, these also have ototoxicity. ये मेरे book में भी है. Drug interaction. So drug interaction or drug food interaction is there. Okay. So drug interaction, they may be either in the body, that is known as in vivo drug interaction, or in the outside, they are known as in vitro interaction. So drug interaction in the body may be either pharmacokinetic interaction like ड्रग एब्जॉर्प्शन, अगर टेट्रासाइक्लिन का अगर कैल्शियम सॉल्ट या फिर एंटासिड के साथ मिलेंगे तो वो ये हो जाए, उनका कॉम्प्लेक्स फॉर्म बच जाता है और टेट्रासाइक्लिन इज नॉट एब्सेंट. So drug distribution distribution interaction is there, metabolism interaction is there. Yeah, we have seen this displacement reactions. Okay, metabolism में enzyme interaction inhibition, microsomal enzyme interaction inhibition. We have seen excretion में भी होता है drug interaction. Some drug will increase the excretion of few drugs. So you can read charts are given in the book. For example, in vitro में क्या होता है? In vitro interaction लाइक अगर आपने थायोपेंटोन का इंजेक्शन है मिथोनियम सोडियम का इंजेक्शन मिक्स किया तो दोनों में प्रेसिपिटेशन हो जाएगा, तो यू कैन नॉट इंजेक्ट दैट, दैट इज इन विट्रो. अगेन डायजिपम का इंजेक्शन है और सलाइन में डाल दिया आपने इन्फ्यूजन फ्लूइड में, प्रेसिपिटेशन हो सकता है, तो यू हैव टू डिस्कार्ड दैट एडजुवेंट. ओके, इन विट्रो ये सब बाहर होता है. ठीक है, फिनिडोइन का इंजेक्शन अगर आपने सलाइन सॉल्यूशन में डाला, अगर प्रेसिपिटेशन हो गया तो आपको उसको फेंक देना है. ठीक है, यू कैन नॉट यूज. सो दीज आर द इन विट्रो. इन विवो में क्या होता है, अगर अगेन हिपेरिन हाइड्रोकोर्टिसोन इनएक्टिवेशन ऑफ हिपेरिन इन विट्रो इंटरेक्शन, केनामाइसिन हाइड्रोकोर्टिसोन इनएक्टिवेशन ऑफ केनामाइसिन इन विट्रो इंटरेक्शन, then carbamazepine gentamicin inactivation of gentamicin in vitro. So you cannot use the combination together because of inactivation of another drug. In vivo interaction बॉडी में क्या होता है, टेट्रासाइक्लिन एल्यूमिनियम मैग्नीशियम फेरस कैल्शियम सॉल्ट अगर साथ में यूज करेंगे तो चिलेशन ऑफ एंड फॉर्मेशन ऑफ कॉम्प्लेक्स ऑफ टेट्रासाइक्लिन व्हिच इज इनसॉल्युबल. सो टेट्रासाइक्लिन का एब्सॉर्प्शन नहीं होगा. टेट्रासाइक्लिन सोडियम का बाइकार्बोनेट चेंज इन द पीएच डिक्रीज द एब्सॉर्प्शन टेट्रासाइक्लिन. So in vivo cholestyramine warfarin decrease the absorption of your warfarin drug in vivo interaction absorption. Cholestyramine digoxin decrease the absorption of digoxin. Cholestyramine thiazide diuretics decrease the absorption of thiazide diuretics. That are some examples of vivo. बाकी अपन ने देखा है distribution interaction वगैरह. So this was our today's lecture. Now we'll see again in the evening. 4 बजे फिर से ज्वाइन हो जाओ. 4 बजे